Hello, welcome to Dr. Ties, your medical expertise whenever you need. Please note that this is purely for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today I will talk about Lyme disease. Lyme disease is a bacterial infection that is caused by the bacterium Borrelia Burgdorferi. This can spread to humans from infected ticks. Some people may be unaware of the tick bite. 90% of patients with Lyme disease present with erythema migrans. This is a circular or oval-shaped rash around the tick bite which can expand outwards. The rash can be flat or slightly raised, and it is not usually itchy or hot. This rash usually appears within 1 to 4 weeks after the initial tick bite, but this could be up to 3 months. The rash can last for several weeks. There may be associated flu-like symptoms such as fever, shivers, headache, muscle and joint pain, fatigue and loss of energy. Not all ticks carry the bacterium that causes Lyme disease, and the risk of infection is low. It is still recommended to remove a tick if possible. It is advised to use a fine-tipped tweezers or tick removal tool to grasp the tick as close to the skin as possible to remove it. The tick should be pulled upwards without squeezing or crushing it. The bite site should be cleaned with an antiseptic or soap and water. It is advised to see a doctor if there has been a tick bite with subsequent rash and flu-like symptoms. A blood test for serological analysis may be required to confirm the diagnosis of Lyme disease. Serology may take several weeks to become positive following the tick bite. Retesting may be needed if the initial test is negative and there are still symptoms of Lyme disease. Lyme disease is normally treated with a course of antibiotics such as doxycycline. The duration of the antibiotics depends on the symptoms or stage of Lyme disease, and this can be 2 to 4 weeks. Most people recover fully with the treatment, although this can take several months for some people. If symptoms continue for a long time, a specialist assessment in the hospital and further blood tests may be needed.